Okay.
So our PowerPoint is on motivational interviewing. What is motivational interviewing? Motivational interviewing is a collaborative, person-centered form of guiding to elicit and strengthen motivation for change. It focuses on exploring, resolving ambivalence, and centers on motivational process within the individual that facilitate change. This method differs from other methods by supporting change in a manner congruent with the person's own values and beliefs.
The motivational interviewing approach. Motivational interviewing, which is shortened to MI, is the identification, examination, and the resolution of ambivalence about changing behavior. It's basically about everyone's willingness to change, and you have to first identify it, then you have to go into more detail and examine it, and then afterwards you resolve the problem and switch to the change. MI is particular kind of conversation about change. It's counseling, therapy, consultation, and it's a method of communication. MI is collaborative, it's person-centered, it is a partnership, it honors autonomy, and it's not expert-recipient. The person, the client, is the expert, not the social worker. And MI is evocative. It seeks to call forth the person's own motivation and commitment. The social worker can't tell you what to change, it has to come from yourself.
So there are 8 steps to motivational interviewing. The first step is the spirit of motivational interviewing. The patient, not the social worker, possesses substantial personal expertise and wisdom regarding themselves and tend to develop in a positive direction and given proper support. So like we said before, the patient being the client is the expert, not the social worker.
Step 2 is the ORS client-centered counseling skills. This is a stage not unique to MI. Many other counseling techniques use this. It involves acquiring proficiency in the use of classic client-centered counseling skills. Just the basic, setting, sitting down, talking. It's just the basic setup of the interviewing.
Step 3, recognizing and reinforcing change talk. Motivational interviewing departs from client-centered counseling and being consciously and strategically goal-directed. MI is directed toward particular behavior change goals, and a key process is to help clients resolve ambivalence by evoking their own essential motivations for change. So the client needs to have that motivation to change in order to eventually change themselves.
Step 4 is eliciting and strengthening change talk. Once a social worker is able to recognize the change talk within the client, they are in a position to elicit and reinforce it, which basically means they need to keep talking and drawing on the change, not the resistance part of the client. When change talk occurs, the social worker may reflect it, affirm it, or ask for elaboration or examples from the client. The MI social worker asks open-ended questions, which is change talk. An example of this would be, in what ways might this change be a good thing? And is cautious with questions that answer to which is resistance. Why haven't you changed? If you focus on the resistance part of this, the motivational interviewing will not work. You need to push the client towards change and only change.
Step 5, rolling with resistance. Direct refutation of clients' arguments against change tends to reinforce them. The social worker and the client are acting out the client's internal ambivalence, with the social worker taking the pro-change side and the client arguing against the change. This is counter-therapeutic. So there's always going to be resistance with change and the client not wanting to change. So it's important to know how to handle that resistance from the client.
Step 6 is developing a change plan. Most clients verbalize progressively stronger statements of their desire, ability, reasons, and need for change, which in turn increases the likelihood that commitment language will emerge. Commitment language is different from change talk because this is a more, it's a stronger sense of change, and you know that they're actually starting to commit to change and not just talking about it. The usual procedure is to offer a transitional summary of change talk, the desire, ability, reasons, and need that the client has offered for making a change, and then you ask a key open question, the essence of which is what's next. You need to make sure the client is the one that answers the what's next. If they don't know, then they're not ready to move on to developing a change plan.
Step 7, consolidating client commitment. The crucial step here is the client's will to commit to change. This is not a reason to push immediately for commitment because doing so permanently can undermine behavior change. This step is similar to 4, but instead of listening for change talk, the social worker is listening for commitment language. So just knowing that the client has to commit here in this subset.
And step 8, which is the final step, is switching between motivational interviewing and other counseling methods. Motivational interviewing was never meant to be the only tool social workers should use. The clients who are ready for action when they present for treatment are unlikely to need MI. It's just people who are more resistant or not quite sure they're ready to change need motivational interviewing to kind of push them in that right direction. When MI is done successfully, an initially ambivalent client advances in motivational readiness, develops a change plan, and then commits to the change plan. At this point, if treatment is to continue, the counselor would normally shift to a style that facilitates action. Motivational interviewing is not about action, it's about leading up to the action. And that is the last step of motivational interviewing.
So we decided that with you guys, we were going to focus on step 6, developing a change plan. So this is what we have chosen to do with you guys. And we'll now conclude our lecture and move on to the role play work.
Any questions for them? So what kind of population, you said, when they're ready for action, you really kind of shift away from motivational interviewing. So what kind of populations do you ladies think in your research have found really need the motivational interviewing?
Well, what we did for our papers was people struggling with substance abuse
Mm-hmm.
issues, alcoholism, and that's one of the things we found a lot of research on.
Mm-hmm.
I also found eating disorders was also on there too.
Sure.
One of the articles I found was elder substance abuse, the elderly population
Mm-hmm.
with substance abuse. Too,
Yep.
so.
And I actually
That's
found an
cool.
article with schizophrenia,
Mm-hmm.
which is pretty interesting because usually that's something people have to deal with. But I mean, it can be used for a variety of methods. It's just mainly dealing with people who are resistant to change.
Sure. Do you think it would work for like involuntary clients? So like people from the prison system or the Department of Corrections that have to go someplace? Do you think that the motivational interviewing could help shift from the you have to go do this, so too bad, and darn it, I don't want to? Do you think it could help motivate to change?
No, because the client wants to change and has to want to change in motivational interviewing, and clients like that who say they have to be there, and the social worker saying you have to do this just won't work for them.
Right, so they probably need to go along those stages of change, those steps a little bit further in order to kind of use some of those skills a little better.
Yeah, now if they were at first resistant and then somewhere along the way they decided they wanted to change, then they could use this method. But if they don't want to change, then motivational interviewing won't work.
Right, right. Any other questions? Comments? No? All right.